Hi everyone, this is JhunlieEscala once again. And for today, we'll be discussing about the stages of delivery still under your maternal and childhood nursing concept. Ayan. So, alam nyo, as I've said a while, while I was discussing the previous topic that we had under your maternal and childhood nursing, I told you that it's one of the isolated concept in your nursing education. So, hindi po tayo nagkakamali doon, no? And it's very essential also. Ito madalas tong tinatanong in the boards. And notwithstanding it's a very, very basic concept, marami pa rin po ang hindi alam or hindi ka pa ang stages of labor and delivery. And for that, we'll be discussing that for today. Okay, so let's talk about your stages of delivery. Okay, so kapatid, kapag sinabi nating stages delivery is actually something that's just divided into a very, very few processes. Okay, so ito yung mga processes that we have and we are talking about. Okay, so about this labor and delivery. Okay, so when we say stages of labor and delivery, it's just actually divided into 4 parts. Kapatid, kapag sinabi natin again, stages of delivery, stages of labor and delivery, it's just divided into 4 parts. And remember about the concept, that's why sinabi siyang stages of labor and delivery. Ibig sabihin, dalawang konsepto dyan ang nakapaloob. The labor and the delivery processes. Okay? So, what are those stages? Ano nga ba yung mga stages na yun? First, we have the stage 1, which we call as your labor stage. Okay? So, kapatid, sa labor stage na to, all you have to think is about, syempre, from the word itself, labor. Ibig sabihin, naka-focus siya on the concept of labor. And when we say labor, kapatid, it's where the labor pain starts. Okay, and we have to determine whether or not the labor that the patient is currently feeling or experiencing is the true labor or the false labor. Basta, all you have to think is just about the labor pains, all about labor. Okay? And isa pa dito, kapatid, because we'll be having a separate and isolated discussion on this one after discussing some few concepts. General few concepts, no? So, another concept na pumapasok sa ating stage 1, kapatid, is ang pagbukas po ng ating cervix or tinatawag po natin itong cervical dilatation. That's why, ang ating pong labor stage is otherwise known as your cervical dilatation stage or dilatation stage. Okay? So, that's what we call as your stage 1. Now, let's proceed to your stage 2. Kapatid, sa stage 2 naman, ang pinag-uusapan natin dito, ang stage 2 naman po is what we call as your delivery stage. All you need to think here sa stage 2 na to is the baby. Okay? Stage 1, the labor pain. Stage 2 is the baby. That's why we call it delivery stage. Sinong dinideliver natin in your stages, in your labor and delivery concept? Labor and delivery concept, of course, no? Si baby. Siya ang pinakasentro dito, no? It's in stage 2 wherein the baby will be delivered. That's why tinatawag siya minsang the expulsion stage. Okay? Kung saan inilalabas natin si baby. Okay? Again, when we say about stage 2, you just think of your baby. Okay? So that's what we call as your delivery stage. Now, let's proceed to your stage 3, which we call as your placental stage. Kapatid, sa placental stage naman natin, ang pinag-uusapan natin from the word itself is your placenta. Okay? So, placental stage, you just think of your placenta because it's the center of your placental stage, or we call it sometimes as your placental delivery stage, wherein you deliver the placenta. Okay? Because aside from delivering the baby in your stage 2, it's also important to have the placenta delivered because all of the products of conception has to be delivered, both the baby and the placenta. Okay? So, kapag sinabi nating stage 3, kapatid, all you have to think is your placenta. Stage 1, labor pains. Stage 2, the baby. Stage 3, the placenta. Of course, let's have the stage 4, which we call as your immediate recovery stage. Okay? So, immediate recovery stage na to, it's where the first 2 to 4 hours of labor and delivery process occurred. Okay? So, ang pinakamahalaga dito, kapatid, is that you should be avoiding a complication which we call, of course, we call that in complication, or in more complex term, we call that one as uterine atony, Okay? So, kapag sinabi natin kapatid na uterine atony, it's the state ng inyong uterus kapatid na kung saan hindi siya nagko-contract because your uterus must be contracted in the immediate recovery stage for you to avoid, which we call as the complication, which we call as your uterine atony, na kung saan it will lead to bleeding. Dapat kapatid ang inyong uterus it remains to be contracting in a very, very minimal or is just enough to stop the bleeding. Kailangan natin ng contraction para hindi mag-bleed. Okay, ang ating uterus. Para, again, to avoid the complication which we call your uterine atony. That's why we do all the interventions para walang bleeding. Ang focus natin in your stage 4, kapatid, is your bleeding. Okay? Bleeding, bleeding, bleeding. You avoid the bleeding. Dapat alam ni nurse kung paano tingnan ang signs ng bleeding. Okay, dyan yan pumapasok. Kapatid, again, stage 1 to 4. Stage 1, you just think of labor pains. Stage 2, kapatid, the baby, because the baby will be delivered on the stage. Stage 3 naman is the placental delivery stage. And your stage 4 naman, kapatid, it's the immediate recovery stage, and then you just think of avoiding the bleeding. Okay, so now, to have this discussed in a very, very detailed na process, okay, or the very detailed explanation, kapatid, again, so stage 1 is your labor stage, okay, which is divided into phases. Later on, we'll be discussing yan. I promised you earlier. So it's the period from true labor hanggang crowning. Kapatid, ang crowning na yan, it's the status wherein you can also already see the presenting part, which is head, which is the common the common presentation po ng ating pong baby, which is to be delivered. Okay? So, pangalawa, we have the delivery stage is from crowning, from that crowning until the full delivery of the baby. And in the placental stage naman, kapatid, from expulsion of the baby until the delivery of the placenta. And of course, kapatid, doon nandito ang ating immediate recovery stage, which is the immediate 2 to 4 hours, I've said earlier, from the delivery of the placenta. Okay? So, immediate recovery stage or immediate postpartum, ang pinakamalagang iwasan natin dyan, kapatid, I told you earlier, is bleeding. Okay? So, you need to remember about those concepts. Now, sabi ko sa inyo that your phases of labor, the labor stage or the stage 1 is further divided into phases. Ito pong labor stage na to, okay, in the first a stage of your labor and delivery is further divided into phases. Huwag tayong palilito dito, kapatid, kasi kapag tinatanong tayo, kapag what are the phases of, what are the stages of labor, you immediately think of these 3. Sabi ni Adele Pelletieri, yung 4 kanina, we call them as your stages of labor and delivery. Okay? Pagdating naman sa phases of labor, ito yung sinasabi dito. Yung stage 1 in your stages of labor and delivery is further divided into 3 phases. And it's what we call as your latent, active, and transition phases. Okay? So now, kapatid, anong ibig sabihin nito? So dito, nakafocus tayo, kapatid, sa dilatation ng inyong cervix. Okay? Ang cervix po, para ma-accommodate po ang paglabas or birth ng baby natin, it has to be opened. Of course, for that to be opened, we measure it by centimeters. Ito na yung napapakinggan natin while we are doing our duties, kapatid, in the delivery room, na kung saan sinasabi ng OB ng pasyente natin, ng mga anak na 3 cm na, 4 cm or 8 cm na ang pasyente natin. And we never understood that. I have some students na hindi nila alam kung what does it mean really. Now, alam mo, kapatid, it's just a measurement ng pagbukas ng cervix. It's a cervical dilatation na kung saan minimeasure siya in centimeters. That's why we call it 1 cm, 2 cm, 8 cm. Kapag sinabing 10 cm, hala, mga anak ng pasyente natin, and that's true. Okay? So, ang cervical dilatation natin in your latent stage is nasa 0 to 3. So, kapag nakarinig ka, kapatid, ng 0 to 3, cervical dilatation, example, 2 cm, ibig sabihin si patient natin is nasa latent phase of labor pala. Okay, so now let's do the understand the duration of the labor. Okay, so labor, kapatid, it's the labor, kapatid, or the contraction Okay, it means it is the process, the entire process of contraction, the relaxation, and the feeling or sensation of the patient of the pain. Okay? So dito, we will be thinking of the contraction. Kapag sinabi natin contraction, kapatid, yung paninigas. Okay? This is the uterus, kung gaano siya katigas. Okay? It is what we are measuring here. Okay? So, when we were on our, I think, second year to third year, we were taught, I mean, we were taught how to have this one measured. Okay, so this is measured actually in seconds kung gaano siya katagal. Okay, literally when we were having our labor monitoring, kapatid, binibilang namin siya kung gaano siya katagal. That's why it's where you already use your wristwatch. Okay? Na merong hand. Ganon, may second hand, di ba? Okay? So, duration, so you binibilang ninyo from the moment na una siyang tumigas, at kung tatagal siya ng 20 to 40 seconds, ibig sabihin nasa latent phase of labor pa lang tayo, kapatid. Okay? So, ganun lang siya katagal. Okay, so ang cervical dilatation mo nasa 0 to 3, ang duration naman ng inyong labor, kung gaano katagal yung paghawak ninyo. Paano mo malalaman that the patient is contracting or the patient's uterus is contracting? You palpate the uterus of the patient through the fundus, you palpate the fundus of the patient, at kung tumitigas, okay, at kung sumasakit at nafe-feel ni nanay, that's the moment, kapatid, na nasasabi natin that the patient is actually contracting, or the patient's uterus is actually contracting. So kapag tumatagal siya ng 20 to 40 seconds, so it's we could say that the patient is in latent phase of labor. Okay? So ngayon, let's talk about intervals. So sa interval naman to, this is actually, we're talking here of your minutes. Okay? So tumitigas, kapag tumigas yung patient, I mean yung fundus ng patient natin na nagle-labor, and then, ayun, binilang mo, naka 30 seconds lang siya. Okay? So, you need to count when again, or kung kailan uulit ang pagtigas ng uterus or yung fundus ng pasyente natin. Okay? So, that's what we call as your interval. Usually, okay, in your latent phase, kapatid, this will happen again after 5 to 15 minutes. Okay? So, the moment you check it, halimbawa, you check it at 9 p.m., you have to expect that it will happen again between 9:05 hanggang 9:15 p.m. You need to remember that one. Okay? So sa active labor naman, it's the same. We just increase 4 to 7 centimeter, kapatid. Kapag tinanong ka na, kapatid, okay, 4 to 7 cm na si patient ninyo, and then the duration of the contraction is nasa 50 seconds, and then yung interval po nito is nasa 4 minutes. So you need to understand that the patient is already in in her active phase of labor. Okay? So you need to remember that one. And for your transition also, kapatid, it's where napakalapit ng mga anak. That's why we call it transition, because the patient is already transitioning towards the expulsion of the baby or the birth of the baby or the delivery stage. So, usually mas matagal dito, no? Nasa 60 to 90 seconds. So, kung mapapansin niyo 1 minute na to eh. So, sobrang matagal, 1 minute yung pagtigas. Just imagine yung uterus ng nanay mo, no? Pinipiga niya, okay, para lumabas si baby. That's literally what's happening inside the uterus. So, 60 to 90 seconds. And of course, kapatid, for your interval naman, mas madalas na siya. So, mas matagal na yung pagtigas, and then, mas mabilis na. Okay? So, 2 to 3 or 1 minute to 3, 1 to 3 minutes, so it will happen again. Okay? So, mas madalas and then mas matagal na yung pag-contract ng uterus ng patient natin. So, just imagine. Okay, I have actually made a song. May song tayo dito, kapatid, no? Just find it, no? I-search po natin in my channel, in my YouTube channel. And it happens this way. 0 to 3, 4 to 7, 8 to 10. 0 to 3, 4 to 7, 8 to 10. Latent active transition of 20, 40, 60, 5 to 15, 3 to 5, and 2 to 3. Yan. So, hanapin ninyo, kapatid, dito sa ating YouTube channel, and you just memorize the song. And if you will be facing such question, Once again, of course, napakadali nang sagutin. Okay? So, tandaan natin yan. Okay. So, let's move on, kapatid, to your pharmacology in your labor and delivery. Okay? So, alam nyo, kapatid, dalawang major classification lang actually ng ating pong medications ang dapat ay i-memorize natin at maintindihan natin. First, we have your tocolytics. Okay? So, first tocolytics, and we have your oxytoxic drugs or your oxytoxics. Okay? First, again, we have your tocolytics and we have your oxytoxics. Okay? Or oxytoxic drugs. Kapatid, kapag sinabi natin tocolytics, they are those medications that slow the contractions. Napakadaling tandaan. So, si tocolytics, pinapabagal niya ang contraction. Upon the other hand, si oxytoxic drugs naman from the word itself, increases the contractions. So, magkalaban silang dalawa. Tocolytics, again, it slows the contraction, and the oxytoxic drug, it actually increases the contraction. Okay, so for your tocolytics, kapatid, dalawang bagay at dalawang major na medications na ginagamit at tumalabas palagi sa board exam, ang kailangang alam natin. First, we have your terbutaline. Okay? Terbutaline, kapatid. Hala, sir, parang ginagamit rin siya sa respiratory system, and that's true. Okay? So, pangalawa, magnesium sulfate. Sir, magso ba yan? And that's also true. Okay? So, sa oxytoxic drugs naman, of course, we have your oxytocin. Minsan ginagamit din po ang ating methergine, but seldomly. Pero yung mainstream talaga, usually lumalabas sa boards, kapatid, is your oxytocin. Okay? You need to remember that one. Okay? Terbutaline and magnesium sulfate for your tocolytics and oxytocin for your oxytoxic drugs. Okay. So, now let's talk about your terbutaline. So, ang terbutaline po, how does it act? It actually acts in the respiratory system, and that's true. It is acting by dilating the airways, the bronchus. Okay? So, it serves as a bronchodilator of the smooth muscles in the airways, and it also slows or stops the contraction of the uterus. So, it also slows or stops the contraction of hollow organs like your uterus. So, kasi dilate siya ng ating smooth muscles like your airways. So, ganun din ang ginagawa niya, kapatid, sa inyong uterus. Okay? So, it also it weakens the lining of your uterus. Hence, it stops and slows the contraction of the same. Tandaan natin yan, kapatid. And, kailan to ginagamit? This is actually used, or most of the time used, in your preterm labors. Why preterm labor? Sir, bakit siya ginagamit sa preterm labor? It's very basic concept. When do we like to have our mother or our pregnant mother experience labor? Dapat sa term na, di ba? So, if it's preterm, kapatid, we need to slow down or we need to stop, okay, the contraction. Bakit? Hindi pa panahon para ipanganak si baby. That's why we need to stop or slow down first. Slow down first and then totally stop the contraction of the uterus. Kasi hindi pa kapanganakan ni baby. Okay? So, we need to stop it. Okay? So, there are some considerations while using terbutaline. First, you need to monitor CNS for overstimulation, monitor vital signs, kapatid. Of course, monitor the fetal heart rate for us to know the total or the well-being of the baby, and of course, monitor EKG. Tandaan natin yan. Okay? So, that's for your terbutaline. Let's discuss another medication which we all know, the magnesium sulfate or MAGSO. So, your MAGSO is actually it's an electrolyte, tama? Okay. So it balances electrolytes, and it also relaxes muscle. It's a muscle relaxant. It's actually a potent muscle relaxant. This is also actually given in your asthma attacks. When I was still in the ER, ginagamit to, no? During asthma attacks, yung talagang pinakagrabe na, lalo sa mga status asthmaticus cases, no? So this is given also in your patients na may hypomagnesemia. That's why I told you it's an electrolyte, and also for cases like your torsades point, it's actually an electrical activity of the heart na kung saan, kapatid, it's very cardio. Okay, so there's abnormality in the electrical activity of the heart. Okay? Also in your preeclampsia. Also in your preterm labor seizures, kapatid. Why? Because in your seizures, kapatid, it's where your muscles are actually shivering, very tense. That's why we need to relax it, kapatid. Why? Because your magnesium sulfate is a muscle relaxant. Okay, so while using magnesium sulfate, you need to monitor for hypermagnesemia. Ano bang mga signs niyan? Confusion, dizziness, weakness. Baka sumobra tayo sa relaxation ng ating muscle and decreased reflexes, kapatid. And it is also given slowly via IV, most of the time IV, and seldomly IM. And also you need to have our patient um, parang i-warn natin sila that they or may experience some flushing or medyo mainit, okay, na sensation while receiving the medication, kapatid. Okay? But firstly, you need to give it very, very slow. Okay? So, that's it for your magnesium sulfate, kapatid. So, another is your oxytocin. So, ang oxytocin natin, as I told you, kapatid, it actually induces labor by stimulating the uterine muscle to contract. Okay? So, it increases the contraction of the uterine muscle. So, what are your nursing considerations here? Monitor contractions, monitor fetal heart rate, and also you need to warn the mother of increased labor pains and also monitor vital signs, glucose, and potassium. Simple lang, kapatid. We don't want our patient to have a very, very severe, or we call it hypertonic contractions. So you also need to monitor the patient's contractions here. Baka sumusobra na tayo doon sa napag-aralan natin kanina na 5 to 15, okay? Yung 3 to 5 and 2 to 3. Okay? So baka naman hindi na totally nag-stop yung ating labor ng patient. So it's also very, very dangerous. Tandaan natin yan. Okay? So, also another group of medications, so we have the prostaglandins, which actually ripens the cervix, like you have your misoprostol and dinoprostol. Okay? Again, we have your misoprostol and dinoprostol. Okay? So, for this one, the most famous that is available in the market is which we call a medication which we call as your misoprostol. Ang misoprostol po na ito, this is actually used, no, for stomach ulcers, induction of labor. Pero primarily talaga, when it was actually introduced to the market, it is actually used for stomach ulcers. And it was found out to be, or to have an effect, or we call it abortifacient effect. Which, why? Because it actually induces labor. And further, no, it was later on used for elective abortion. Okay? And also in some, like your dilation and curettage. So, ginamit na rin siya. Okay? So, how does it act? It acts by inhibiting acid secretions. That is for your GI action. However, for your labor, induction of labor, it actually softens the cervix and it causes the uterus to contract. So, ganun lang kasimple, kapatid, ang kanyang action. So, while using misoprostol, you need to monitor fetal heart rate and also remember that it may also cause your uterine rupture. So, dapat, no, well monitored din si patient natin. Okay? So, this is only in the Philippines for as long as we are talking about the Philippines, the setting in Philippines. This is actually one of the regulated drugs, and this is actually very, very hard to acquire this or to purchase this in the market because this is one of the kumbaga, abused medications. No, this is used sometimes for some illegal practices of abortion. Okay, so this is this has to be monitored and this has to be prescribed by an obstetrician and gynecologist. Okay, because ina-abuse tong medication na to. Okay, so again, misoprostol is an abortive patient and it induces labor. And this is used in the Western countries for elective abortion and for other procedures like your DNC. Okay? So thank you so much for being with us in the discussion of your stages of labor and delivery. And I hope to see you guys again in our next discussions in the concept of your labor and delivery. This is one of my favorite subjects, kapatid. So, see you guys. Ingat.